Welcome back, everyone. We're going to talk about Brain Injury Week. So the next 4 podcasts, we're going to talk about the major lessons we've learned here at Amen Clinics about brain injury. So my sister,
my sister. All the kids watching this will know what I'm saying when I say sister. It's like a whole
sister had her 60th birthday party yesterday, and we went, and it was awesome. So talk about brain injury. Aging is sort of, it's not good for your brain.
Well, I don't know if I'd classify it as a brain injury, though.
And I had the most interesting
it's more of a brain assault
conversation with my nephew, who really hasn't talked to me much in the last 10 years because he
probably didn't want to know what you had to say.
How opposed I am.
Well, you have to back up. You have to explain why. He's got these 2 sons who, no joke, are the biggest kids I've ever seen for their age. They've always been so big. So the oldest one now is 14, and I think he's like 6 foot something.
3.
Yeah, it's like
225
crazy.
pounds.
So these kids are huge.
So 9th grade, they want them to play football.
Of course.
They know, my thoughts. Brain is soft, skull is hard.
But the kid could play basketball too.
And he could play tennis, and he could play golf.
But basketball would be like a perfect fit.
And, but anyways, we actually had a really nice long conversation because there are helmet companies saying that, and they're expensive, like up to $1,800 for a helmet that decreases the forces. And he's like, well, of course, that will then make football safe. And the problem is helmets decrease skull fractures. They can't stop the jostling around of your brain inside your skull.
Well, and there's another issue. So I was a neurosurgical ICU nurse, right? So no one really thinks about this because we would get in motorcycle riders all the time and athletes. And something that we saw actually a significant amount of in a neurosurgical ICU unit were something called compression fractures. So yeah, they're wearing helmets, right? So they think they're safe. What they don't realize is if you go in the air and you land on your head, no one really thinks about the force on the spine, on the neck, on C1, C2, whatever, on your cervical spine. We would get people paralyzed. So because they would land on their heads, and they still ended up with concussions, but they would, like, severe brain injuries sometimes. But what they don't think about... Well,
if you just think of what is going on when they're slamming their spine that causes the compression.
Right, well, and the helmet sort of ends right there.
But what is going on the forces inside your skull with your soft tofu custard, somewhere between egg whites and jello brain, is the slamming up against the sharp, bony
but
ridges.
all of your discs in your spine and your, that's all at risk as well. And no one really talks about that. So it's like, you can wear a helmet, you're still going to hurt your brain, but you're also at high risk for other injuries right around your neck area.
Well, and that's actually very sensitive for you at the moment.
Yes, because I'm suffering from a neck injury. So I'm not very happy. Well, actually, I'm like one of those people, if you give me a plan, I'm going to work it to death. So I'm like very hyper-focused on my plan at the moment because I don't want surgery on my neck. But I've had to like really, really curtail my normal routine. And I really have empathy for our people who write in and they're like, I can't do your program because, you inspire me, but I can't exercise. I'm like, look, I get it. I have to completely revamp everything I'm doing right now for the last few months, actually.
So it started by imaging your neck.
Right.
And as we've talked about on the show before, you actually had a pretty significant injury to your neck and your head.
Right, and I have scoliosis, so it probably impacted it even worse.
And nobody talks about how the most vulnerable day of your life, the number one most vulnerable day of your life is the day you were born.
Right.
and you didn't want to come out the right way.
Apparently not. I was coming out rear end first. So
You were mooning the world.
I was mooning the world. I was mooning the doctor for sure. I'm like, I'm not coming. You can't make me. So he decided he was going to win, and he reached in and grabbed my foot, and I came out doing the splits.
Oh, no. Ouch.
Yeah, but and who knows if that is the entire story, but there are some doctors who think that that was a significant reason, or at least it led to some of the issues with my spine. And so
and why you have scoliosis.
Yeah, and I don't know if that is the reason or not. What I know is I have scoliosis. And so now I have this neck injury, and I got to tell you, there's nothing I love more. My form of therapy is going into my martial arts classes and just hitting things as hard as I can. I like to hit things as hard as I can. I like to kick things, not people, pads, as hard as I can. It feels so good.
You want to fantasize about hitting bad people.
No, it's not. Well, maybe, but that's not really it. It's a release. I can't explain it. It's like this release that you feel. It just feels good. So it's just this feeling of like, oh, it's just like relief. So it's a good feeling. Anybody who practices martial arts knows what I'm talking about. It's just a
And
good
we've
feeling.
actually had many people write into the show that they've actually taken up martial arts after listening to you.
Right. So I love it. So imagine I've been doing this for a long time, but I'm not stupid. Okay. So I now know, I'm not going to say I haven't been stupid in the past, and I haven't not listened, and I have not gone in and done that when I shouldn't have. I have.
I, of course, would never say you're stupid.
I know, but
because
when
then
I was
might get a head injury. That's the
when
whole
I was
point of the
practicing
week.
my black belt test, I did not listen so well, and I did what I shouldn't have done. But now I really get it, how hard it is for some of you, because I can't do the thing I love. But what I tell other people is the same thing that I now have to practice myself. Focus on what you can do, not on what you can't do. I cannot hit stuff right now.
So those of you listening, have you ever had a brain injury? And one of the things that I learned after I started looking at the brain is you have to ask people literally 10 times whether or not they ever had a brain injury. And initially, many people say no. And then when you go, you're one, when I asked you, have you ever had a brain injury after looking at your scan, because you hurt your left temporal lobe, and you went no, because you're thinking of a brain injury.
So I have a gripe with this whole TBI term. Okay, so I have a gripe with the term traumatic brain injury. Now, I get it. Technically, it's correct. But as somebody who works in the hospital, I mean, you've heard me say this before on other podcasts if you listen to our podcasts. But as a nurse who works in a hospital, as a neurosurgical ICU nurse, when you say the word TBI, okay, we're talking people in the ICU with their head split open, or with a drain in their brain. I almost wish we had a term to differentiate.
Well, many people will call it a mild TBI, but I have problems with that because mild TBI means it's not very serious.
Or how about conscious, closed brain TBI? I would be okay with that. Then I would think of it differently.
Well, we can agree on that one. But mild TBI implies it's not that significant.
Right.
And what I've seen is you can totally damage your frontal lobes, your temporal lobes, your cerebellum, whatever. And it came, and you didn't even lose consciousness.
No.
Because consciousness is a brain stem phenomenon where you can completely wipe out your left or right frontal lobes.
But I did hurt my frontal lobe.
Ruin your life. And that's what I talked about with my nephew yesterday. So his son, besides being big and strong, is also an honors student. And he really gets a lot of self-esteem, as does his mom and dad, with him doing so well in school. And I'm like, well, if you let him play football, is it okay for you that if he goes from an IQ of 130 to 115? And he's like, no, that's not okay. But that's what playing a season or two or three or four can do, because the repetitive hits, Joe Louis said, the famous boxer.
See, I knew it. I would have been A complete genius.
It's not the big hits that get you. It's the thousands of subconcussive blows or the little hits that get you. And when we think of you, and I asked you if you ever had a brain injury, you go, no, because you're thinking it's some massive thing. But then what you explained to me was a massive thing, right? Your sister falling asleep at the wheel.
And the whole reason you asked me was because, and you kept asking me, was because you could see the damage to my frontal lobe and to my left temporal lobe on the scan. And you're like, no, I can see it. Like, what happened? Something happened. And you kept pressing. And I'm like, nothing. Like, I've not done anything. I've been falling out of a tree. I haven't, like, never lost consciousness. I couldn't, never broken a bone.
Tell everyone what you then told me when you remembered.
Okay, so if you have listened to our other podcasts, you've heard this. But we were driving, and we were on a very isolated country road, and my sister was driving. I was asleep, and so I had the seat back. Thank God I had the seat back, or I probably would not be here talking to you today. But she fell asleep at the wheel, and she was going about 75 miles an hour and flipped the car.
3 times.
2.5 times, yeah. Because we ended up upside down. So it was not a full 3 times.
So just think you're laying back. Your brain inside your skull is going 75 miles an hour. And then she falls asleep. The car flips over 2.5 times. So just think about what's happening to the forces on your brain inside your skull. So it's twisting. And then when it stops, the roof caved in, right?
Yeah, and there's a good chance I hit the center divider. I woke up, so I don't recall everything.
And so 75 miles an hour, it's twisting, and then all of a sudden, boom, it stops. Slams up against your frontal bone, back against the occipital bone in the back, back against the frontal lobe. I mean, it shakes with a lot of force. And even though you wake up and you're grateful you're not dead, you can see evidence years later that it could have impacted you. And most people don't know that mild, right? I mean, there's nothing mild about that, but mild traumatic brain injury can be associated with depression, as you've talked about on the show. Was that before the depressive episode or after the depressive?
No, the accident was after.
After.
Yeah.
So Lincoln, who suffered with some severe depressive episodes, he was suicidal twice in his life, was kicked in the head by a horse when he was 10 years old and unconscious all night long. And so is that a major TBI? I would argue probably so. But it was a closed brain injury, so we're on the same page with that. So I just want you to ask yourself, have you ever had a significant brain injury? Because when we come back, we're going to begin to talk about the fallout from traumatic brain injuries. And then as we go through the week, we're going to talk about, well, what can you do about it to rehabilitate your brain in the best way possible? Stay with us.
Welcome back. We are talking about TBIs this week, traumatic brain injuries. As I said in the last episode, if you listened, I prefer to differentiate TBI as a neurosurgical ICU nurse. To me, TBI meant you like split your skull or you had a drain in your brain and you were unconscious or in an induced coma or naturally induced coma. So I like to differentiate that term, if we could, for people who have not lost consciousness or not had a major accident to the point that you have been in an ICU unit. Maybe you never even lost consciousness, right? So maybe it's a closed brain injury. You never split your skull open. You never lost consciousness. But if you listen to the last episode, it can happen just from a really bad car accident or falling out of a tree or
falling down a flight of stairs.
Right. Whatever it is. Even if you didn't lose consciousness or you lost consciousness and never went to the hospital. So now today we're going to talk about the fallout.
So, what are things that are potential that could happen if you've had a brain injury? So, as a psychiatrist, I had no idea. And I'm an Army trained psychiatrist where head injuries were a big deal for the soldiers I was treating when I was a resident. And but what research has come to believe, traumatic brain injury is a major cause of homelessness.
Yeah.
That 58% of the homeless men and 42% of the homeless women in a study in Toronto had a significant brain injury before they were homeless.
So I know we've talked about this a long time ago, but my mom had a really, really bad brain injury. Again, it was closed, but this one was bad. She had a brain bleed from her brain injury. She fell really hard on her face, split, like cracked her teeth. She did a whole bunch of stuff. Damage, big damage. She ended up having a brain bleed from it. She had a really bad concussion, and she owns a very successful business. For about that first year afterwards, it was really frustrating to her because for a little over a year, what she complained about was, initially the initial part was just like severe headaches, severe fatigue, like she couldn't wake up, just sleepiness. She had no energy and she had massive brain fog. The fallout, though, after that initial couple months was still, she couldn't understand why she was still suffering from fatigue. She suffered with fatigue for the longest time, way longer than people think they're going to. So fatigue, crazy brain fog. She couldn't, and word dropping. She could, like her memory with words. She could think of the image, but she could not think of the word to go with the image. So she was word dropping. And so it was so frustrating, she'd start crying. And so this really had an impact on her business. She saw the numbers drop. So when we're thinking about things like homelessness, that's the extreme end of it. But it impacts people's finances dramatically. It really hurt her business that year because she couldn't show up, right? She couldn't show up as herself. And so
what is the organ in your body that manages your finances?
Right, it's your brain.
And so any damage to your brain, either from a toxin or trauma, can impact your ability to make money. So people go, oh, well, I can't afford to come and get assessed.
But you almost can't afford not to be assessed properly.
Because continuing.
And by the way, they sent my mom away from the ER saying she didn't even have a concussion. Never did a CT scan. They didn't pick up the bleed because it was a slow bleed. Bleed didn't show up for probably, I think it was like a week. All of a sudden she was not acting right. And we were the ones that sent her. I'm like, my mom's not acting right. She's got to go back in for an MRI. And all of a sudden you could see the bleeding in the brain. But they sent her out of there going, you're fine. I'm like, there is nothing fine with this woman. She had a severe concussion and a brain bleed. So
many people go to the emergency room and their CT's normal. And they go, oh, well, you have a concussion. There's nothing you can do with it. Stay with us because we're going to spend a whole lesson on what do you do for it.
And I have one more question. We cannot move on. Because this is the big thing no, this is important. Because now
you guys can't see it. She's kicking me underneath.
They know because you always tell on me. Stop telling on me. Okay? Stop. I'm gently doing it so that no one knows, but then you tell on me. Why do you do that?
Because you're kicking me.
So you can't move on because this is the part, having dealt with this with people personally, that I know is so frustrating. You're living it, you're doing the plan, you're thinking it should be getting better, but it's not. It takes longer than you think it should. Okay, so how long can it take? Well, not just it could be better in a couple months. What is the other side of the spectrum? How long have you seen, how long do people need to be patient for? Because it's hard, it's frustrating. My mom, it took probably 18 months before she started to really get it back.
And we had her doing many of the things.
She was doing everything.
Except the one thing that didn't happen till a little bit later is her hormones were all trashed.
Tanked.
And it's one of the things we've learned, that your pituitary gland, actually the master hormone gland in your brain, sits in a very vulnerable spot.
This is common.
And it gets damaged, it gets jostled, and all of your hormones, or many of them, are low. And hormone replacement can become critically
She actually
important.
had to replace
And
almost everything.
What we always talk about here is you can't change what you don't measure.
And then one of the other things, because we always talk about hyperbaric oxygen. Now, in her case, she had to postpone that also because if you have a bleed, you can't do the hyperbaric oxygen.
You don't want to put the brain under pressure
not until it's
when you have
completely
a bleed.
healed, right? So that postponed how soon she could do that. So these are things I think people need to know why sometimes it can take so long, right?
So let's
you got to
talk
replace your hormones.
some more about the fallout. So we talked about
Hormones.
homelessness. We talked about financial ruin. What's the organ of relationships? So what is actually, it's not your knee kicking me underneath the table. It's your brain that can't wait until I finish talking. It's your brain, right? So having a traumatic brain injury can change people's personalities, and it can seriously negatively impact your relationships.
Well, and you pointed something out really important. So it doesn't just change your personality because it affects your frontal lobes, which is huge, or your left temporal lobe, or whatever.
90% of the time it affects your frontal lobes.
But then that's huge. But it's also tanking your hormones. Think about a woman in menopause. Oh boy, right? But if you, or a man who tanks his testosterone, now he's got no libido. That has an impact.
No libido, no memory, no motivation, and no strength.
That has a huge impact on your life.
It certainly does. Suicide. There's actually a much higher incidence of suicide, depression, panic disorders, and addictions after someone has a traumatic brain injury. And we are helping someone we love who's got an addiction issue. And how many brain injuries has she had?
I don't know how many of them actually led to some kind of a brain injury, but she's had 19 car accidents. So I don't know how many of them were severe or not. I don't know. But it's a lot.
And I actually want to talk about, we'll do this on the next episode, about the Irlen Syndrome and how common that is after you have a traumatic brain injury. I have one patient I saw who was wealthy, good looking, incredibly successful, and all of a sudden he wakes up one day and he starts having panic attacks. Mm-hmm. And he goes to his family doctor who gives him Xanax.
I remember
and,
that begins to affect everything.
That made him worse.
Right.
And then he gave him Prozac, and now he's like suicidal. And, you know, he called me, and when we scanned him, I'm like, when did you have a brain injury? He says, what do you mean? I said, your scan, just like I did with you, showed that you hurt the left front side of your brain. When did you have a brain injury? And he goes, 2 weeks before my first panic attack. I'm like, oh, what happened? He was mountain biking in the mountains around Los Angeles. And he fell off his bike and broke his helmet, but never lost consciousness. So,
and he's thinking he's lucky.
One of your mild traumatic brain injuries, or what we now say closed head injury, and damaged his frontal lobes. And so you have low activity in the front part of your brain, low activity in the front part of your brain, and then you give them a benzo, Xanax, lowers activity further. Oh, that may not be a good thing. Prozac lowers activity in the frontal lobe. So 2 things to lower activity to the frontal lobes, and he's not sleeping. 3 things lower activity in the frontal lobes.
And he's got like a $500 million company he's trying to run.
And you like your glass of wine. Now we have 4 things that lower activity in your frontal lobe. No wonder you can't inhibit the bad thoughts you now have, and it puts you at great risk for suicide. And so I'm like, we have to repair this. And when we repaired it, he did so much better. But you can just see, because most psychiatrists, family practice doctors, internists, OBGYNs never look at the brain, they're prescribing these powerful medications that change the brain, and they're not dealing with the original problem.
Yeah, and as we talk about fallout, we often talk about everything through the 4 circles, bio, psychosocial, spiritual. And as we're talking about this, you begin to see why people get depressed, why they become suicidal. Because, I mean, it's not just affecting just as though your frontal lobes weren't enough, but it's not just your frontal lobes, it's your hormones, it's your relationships. All of a sudden, your business, everything begins to become affected. And so now it's like the sweater that unravels.
Yeah. Just one more story quickly. Is one of our friends who's actually incredibly famous and sweet and loving, never could manage his money. And when I scanned him, he clearly damaged his frontal lobes. So incredibly talented. But even in his 80s, he didn't have any money. And I'm like, Jay, did you ever have a head injury? He said, no. And I'm like, well, are you sure? Have you ever fallen out of a tree, off a fence, dove into a shallow pool? No. Ever in a car accident? No. And then he stopped. And he said, I'm so sorry I lied to you. I'm like, what? I've had this happen so many times. He said, I was 19 years old. I was in a head-on collision. I wasn't wearing a seatbelt. My head broke the windshield. Mm-hmm. And I was dazed. I actually lost sight for 4 hours. Do you think that counts? I'm like, yeah, I think that counts. So if your behavior or the behavior of someone you care about is not what you would want, this is so important to consider. Image if you can. If you can't, be on the rehabilitation program we're going to talk about coming up soon. Stay with us. Welcome back. We are having fun. I guess we shouldn't say that. With
We always have fun. Why shouldn't we say that?
Brain Trauma Awareness Week.
Well, yeah, we're having fun giving you awareness. We're not having fun with brain trauma. We don't want people to
we are not banging each other's heads.
No.
Right? I mean, you see that in the movies all the time. You see it with the
There's only one thing that would
Worldwide
cause me to
Wrestling
bang
and
somebody's head, and that's if you hurt my child. Probably.
mixed martial artists and traumatic brain injuries from football, from soccer, from riding a horse. And you know what I know, and then you drive on the freeway. It's a wonder, really, that anybody gets home.
Oh, don't get me started. Oh my gosh. It is the most frustrating. Now that I have to drive to Los Angeles so much, we have our Encino clinic, and I'm up there all the time with Chloe. Oh my gosh. What is the matter with people? There must be so many bad brains on the freeway. It's crazy. It is just crazy. It's craziness. I need to carry cards and just fling them out the window. Like, it's so frustrating. I suppose it's better than other hand gestures you could give. So.
Well, and if your sister fell asleep at the wheel and rolled the car at 70 miles an hour, 75 miles an hour, you're more likely to react when people do stupid things.
Oh, so you're blaming it now on my car? Oh, I see. Okay.
Then not to react because, all of us, when we get cut off on the highway, we should do a whole lesson on road rage. I've seen so many people who've had road rage. And, in my mind, I get the thought in my head, you bastard. Sorry for swearing. But I get that thought, you bastard. And then I leave it alone. because they're seriously
No,
crazy people.
I had someone
out
actually
there.
get out of his car and pound on my window, and I didn't actually do anything that time. There are plenty of times that I have. That time I didn't. That guy was actually just crazy.
So just to my point,
That scared me so bad.
so if you just look at the brain injury statistics, it's estimated from the CDC, 2 million people every year in the United States have a brand new brain injury, traumatic brain injury. That means over the last 40 years, there's 80 million people around. Now, yes, concentrated more in LA. There's 80 million people who have traumatic brain injury. And what do you think the prison population, the incidence of traumatic brain injury? It's very high according to a number of studies. So from prison to homelessness to bankruptcy to people who struggle with ADD, anxiety, depression, suicide. It is rampant in our society. And because psychiatrists never look at the brain, they really don't appreciate it is. But in this podcast, I want to talk about the Irlen Syndrome. And when I first learned about it in 1994 at an international adult ADD conference, I thought it was nonsense, right?
And so do a lot of people still.
Well, they're misinformed.
They're uneducated.
So let's inform
Right.
them. This was developed by a school psychologist, Helen Irlen, who is from Long Beach. And she found that many kids who were struggling with reading, with focus, with anxiety and depression actually had a visual processing problem.
See, I don't see why that is so hard to understand. Visual processing problems lead to issues, right?
Well, and if 30% of your brain is dedicated to vision and you're not processing things properly, you're not going to feel right. And let me just tell you a story. There is a woman who had the holy trinity of Amen clinics. She came to us with ADD, anxiety, and depression. And she saw one of the doctors here who diagnosed her with Irlen Syndrome. That when she read, the letters would move on the page. That's one of the symptoms. Or what she'd read, if she ever read on white glossy paper, she'd get headaches. She had blurred vision. She had depth perception issues. She was not good at sports, and she hated sports. But when she was young, she was good at music. When the doctor diagnosed her, we actually sent her over to Long Beach and got screened. And my sister was there at the time because my nephew also has the Irlen Syndrome. And she called me up. And I was with a patient, so I didn't answer. And then like a minute later, she calls me again. She's sort of like you do that to me.
It's like, why are you ignoring me?
And I know if you've called me 3 times in a row, somebody's dead, right? It's like, doesn't matter what you're doing, answer the phone. So when the 3rd time she called, I thought, oh my God, my mom's dead.
It's okay. Don't even say that out loud.
That's what I thought.
Oh, okay.
And so I answered the phone and I'm like, what? And she said, you can't believe this woman you guys sent over here who has the Irlen Syndrome. When she put on the glasses, because that's the treatment for it, it's colored filtered lenses. When she put on the glasses, she saw the bookcase come out from the wall. She saw the doorknob come out from the door. She saw a guy that was overweight walk by and she blurts out, pot belly, because she had depth perception problems and every guy was sort of 2D, and now this guy's 3D, and that's very rude to blurt out pot
so
belly, but it's the
funny.
first time she'd seen it. And so my sister was like all excited, and so we scanned her the next day, the woman, on the glasses that really helped her get better depth perception and treat the Irlen Syndrome. And we're like so excited because she had a very busy brain and her whole brain calmed down just wearing the glasses. It was really cool.
So I have one story about
Can I
this.
finish this one?
Oh, I thought you were done. I'm sorry.
I'm not even close.
I am so sorry.
Well, thank you for apologizing. That actually warms my heart. So, no, you got to know. So like Paul Harvey used to say, the rest of the story.
Oh, yes.
You remember that?
Yes.
So here's the rest of the story. She's better. A week later, she's worse. She's depressed.
Oh.
The doctor, like, goes, I have to tell you the rest of the story. When she's 12, she's actually a prodigy guitar player.
Oh.
She was amazing and was doing concerts and really saw herself going as a professional musician. But she could never learn to read music because whenever she tried to read music, the notes would dance on the page.
Right. It's almost like dyslexia.
And, well, very common with people who have dyslexia.
Right, okay.
They really have this thing we call scotopic sensitivity
okay.
syndrome, light sensitivity syndrome, or the Irlen Syndrome. And when she was 12, because she couldn't learn to read music, she took the guitar by its throat and broke it and never played again. So now she's 42. It's 30 years later. She's diagnosed with Irlen. Why does she get depressed?
Because she is thinking about what could have happened.
She's mourning
Right.
the loss of what could have been in her life.
If only someone had realized.
And that is not a Prozac moment.
No.
That is not
a happy
you have
Hallmark
to,
card.
You know, it's a psychotherapy moment
Right.
to work through the loss and then get to the place of gratitude that I don't have to have this anymore.
So I just want to...
But think of
I
how
know, it's terrible.
important this is. And for her, we didn't come up with a brain injury, but the Irlen Syndrome is very common after a brain injury.
That's what one of my questions was, can you obtain it post brain injury? It's not like you're always born with it.
Very common.
Okay, so that's one of the things.
So I have NFL players, NHL players, soldiers, and some of my NHL players, actually, we tint their masks
so they can see better when
they can deal with the visual processing issues.
Especially because of the lights. So I was going to quickly mention a story about someone very close to me who, I don't want to talk about names, but this is really kind of a sad, kind of creepy story. She turned out to have almost like the far end of the spectrum of Irlen's, like almost
the
like
worst.
One of the worst cases of Irlen's. But the really sad part of this is that she actually ended up, because it was so bad, I don't want to go into details on it because it'll take too long. She ended up believing that people were after her, like almost like a conspiracy theory type thing, because lights, she would see lights coming at her. And to this day, if she takes the glasses off for very long, she sees lights, like especially under fluorescent lights, she sees beams of lights. And so
it's almost like a psychotic process.
And yes, they diagnosed her as being like psychotic. So when she looks at a phone or anything like that, it's like, so she thought people were doing this to her. When she got the glasses, she almost had a breakdown because of realizing, oh my God, all of this has happened to me. And a big part of it is because of this visual processing problem.
Well, and that's why she had multiple accidents.
And, right, you just gave it away. What is the matter with you?
So to learn more about the Irlen Syndrome, it is so common. Go to Irlen, IRLEN.com, and you can learn about the work of Helen Irlen. If you can relate, if you have headaches and you don't know why. In fact, that's why I began to believe in it. One of my friends who suffered from severe migraine headaches, when she put on the glasses, her headaches went away. And
it makes
she was
sense
not somebody I would have
But if you're having trouble
of.
with lights, that makes sense, especially fluorescent light.
So one of the more common causes of migraine headaches. Stay with us.
So we're back. We're still talking about traumatic brain injuries. And I'm going to, again, clarify that. These can be from closed head injuries where you never lose consciousness. It could be from a car accident. Because if you're like me, I thought it had to be really severe where you cracked your skull and had a brain drain and all that stuff. Does not have to be that. So if you've ever fallen out of a tree off a fence, had a motorcycle accident, but didn't lose consciousness, anything, a bicycle accident, think about it and think if it's had any impact. If you're suffering or struggling, think about the connection that that could have. Please listen to the other 3 episodes that we did on TBI this week. And then we're going to talk about what you can do for TBI. And I am assuming that a lot of it has to do with what part of the brain was injured. And I guess we're going to probably talk about the 4 circles, right? Biopsychosocial, spiritual, and how you address that.
Well, the most important thing you can do is put your brain in a healing environment as quickly as possible. So what are the things you do right away? So you get assessed to make sure that you don't have a brain bleed. That's really important.
Right.
And a lot of doctors recommend a dark room where you do nothing, and they just basically recommend bed rest. The new research is saying that's really not the right thing to do. You don't want to overwork your brain. And if you got it playing sports, you need to go out of that sport until your brain has completely recovered. And just think, if you have a shoulder injury, and you go back too soon, you're much more likely to make the shoulder injury permanent.
Right.
And with the brain injury, you need to be completely symptom-free before you put yourself at risk. And you know us, we're not fans of risk anyways, even if you've never had a traumatic brain injury, because we don't want you to get one. So first thing...
I'm assuming that there are some general things that everyone should stop doing, and then some of them are tailored to the individual.
Correct. And when we talk about bright minds, when we've done the whole memory rescue group, that's really not just memory rescue, it's concussion rescue or traumatic brain injury rescue. Is you want to put your brain in a healing environment. You mentioned the 4 circles, so they're biological factors. So as we go through bright minds, that's mostly biological. There's also psychological factors, not believing every stupid thing you think.
Well, not being in a chronically stressful environment where there's a lot of fighting or a lot of chaos or a lot of just negativity.
Because chronic stress elevates inflammation, and it also elevates cortisol, which prevents healing.
Right.
So quickly going through bright minds as it relates to traumatic brain injury, well, we see the low blood flow on the scan.
Where it's
I saw it
damaged.
on yours. And so you want to increase blood flow in a healthy way. So this supplement ginkgo and vinpocetine, we have both of them in Brain and Memory Power Boost that we have from BrainMD. Hyperbaric Oxygen that we do in the clinics can be really helpful. It's one of the reasons I fell in love with hyperbaric oxygen. Getting rid of toxic foods, processed foods.
Sugar,
it's so
especially,
important, especially sugar.
Cheap oils and yeah.
Right. And so that's blood flow. The B in Bright Minds. R is retirement and aging. When you stop learning, your brain starts dying. So I'm not a fan of people going into a dark room and do nothing. It's push your brain. Read. Learn new things. Because now, don't do it to the point where you get headaches and you get dizzy, but push it just to that point. The I is inflammation. You need to decrease the inflammatory
Again, diet is a big
response.
part of that.
Diet is a big
and
part.
Supplements.
And the supplements, particularly omega-3 fatty acids, curcumin, BrainMD makes brain curcumins. We also have omega-3 power. And probiotics can also be helpful because inflammation comes from leaky gut.
Yep. So eliminating the foods that increase inflammation is critical. Again, sugar is one of the big ones. Processed foods, cheap oils.
And foods that turn to sugar.
Right.
Bread, pasta, potatoes,
gluten-containing
sugar.
foods.
And it doesn't mean you have to get rid of them completely, but clearly limit them is smart. The G in Bright Minds is genetics. And do you know, if you have Alzheimer's in your family and you have a head injury, that significantly elevates the risk further.
That makes sense.
So I actually argue.
Because you're decreasing the blood flow already from the TBI, and then now you have a genetic component.
Vulnerability.
Makes sense.
And it's interesting, they actually did a study on boxers. And boxers who had the Alzheimer's gene, it's called the apolipoprotein E4 gene, who had the gene actually showed cognitive impairment after their 11th fight, where boxers who did not have the gene did not show cognitive impairment until after their 30th fight. And so if you have dementia, depression, bipolar disorder in your family, you need to do what you can to stay away from traumatic brain injuries or make sure you're really aggressively rehabilitating them. H in Bright Minds is head trauma. If you have one head trauma, you're more likely to have another. Why? Because it begins to decrease activity in your cerebellum,
Right,
which
you're
is the major
clumsier.
processing part of
It's
the
like
brain.
my sister. I mean, it's like, my God, 19 car accidents, but she also fell off of a washer, hit her head on. I mean, you look at some people and you're like, how? How do you get through the day crossing the street? I don't understand. And plus she had Irlen's. So the depth perception thing was just like, I'm like, no.
And she's done better. Since
Much better.
she's
She has
gotten
not had the same
treated
problems.
For the Irlen.
So
Tea
much
is
better.
toxins, so you want to make sure alcohol is not a health food. But people,
Smoking.
after head injuries, we've talked about it, they're more anxious, they're more depressed, they have more negative thoughts, they have more financial
So they
problems,
wanna
which means
numb
they're
it.
more likely to numb it with smoking or with drinking or with marijuana that everybody thinks is good medicine, which is complete nonsense. And personal products, right? I mean, there are toxins, parabens, phthalates in your makeup, in your shampoo, in your body wash, in your deodorant. So getting rid of the toxins, putting your brain, your body in a healing environment. Mental health issues, dealing with those. And dealing with those doesn't mean taking meds. It just means what are the natural ways I can deal
Right.
with anxiety and depression we talk about here all the time. I is immunity and infections. Make sure your vitamin D level is good.
I mean, some of these are simple.
Oh, so simple.
Just like fix your diet. Well, diet I know is harder for some people, but even like just the supplements, checking your vitamin D level, that's not hard to do.
And then N is neurohormones. We talked about that during this week. If you've had a concussion, you need to get those levels checked and then optimize. First, there are natural ways to optimize them that I talk about in Memory Rescue, but there you may need hormone replacement.
Yeah, it's that's interesting. We talked about my mom, how all of her hormones were low, but that's something we saw in the hospital. Of course, those were more severe head injuries, but really bad, like no hormones, or like one hormone would just be wiped out, or it was pretty crazy after a head injury.
You cannot believe the number of teenage boys I see who have low testosterone levels. It's
Or
insane.
breasts. I know, because their hormones are messed up.
Right.
So yeah.
Okay. And then we get to D, which is diabesity. So high blood sugar and being overweight,
talked
it's
about.
rampant
Yeah.
in this country. So getting physically healthy helps you be cognitively healthy. And probably one of the most important things you can do is get 8 hours of sleep at night, because sleep often becomes disrupted after having a head injury. And so all of these things are critically important in reversing
That now I know that sounds like a lot
concussions.
of information. I think you laid it out so beautifully in your book, Memory
Rescue. So if you're
So-
struggling with the effects of a concussion, or you know someone who is, and you know, there's almost 1,000 scientific references in there. What I tell people, just go to the end of each chapter. There's a cool little summary.
Right.
There's 10 things to do. Pick one.
And if you're struggling with the food, you can go to my website. You can get the Brain Warriors Way cookbook. We make it simple because people are like, well, I don't know what to eat. That's what you eat. You eat what's in the book. You eat what we have on our websites. What we do here at the clinics is exactly what we would tell you to do. So it's what we have on our we actually provide a lot of those things for you that are either at no or very low cost, because we know not everybody can come in.
So we hope you've enjoyed Brain Trauma Awareness Week. There's so many things you can do. I've seen so many brains that have been hurt get better.
Yes.
That's what we want for you and your loved ones. Stay with us. Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of The Brain Warrior's Way and the Brain Warrior's Way cookbook we give away every month.